Welcome to Healing at the Speed of Light. Every week we discuss how laser therapy is changing healthcare and how you can benefit. Now, here is your host and founder of Laser Therapy Institute, Dr. Jason Rountree.
Hello, thanks for joining us again this week on Healing at the Speed of Light. My name is Dr. Jason Rountree and I'll be your host. This one is sponsored by Laser Therapy Institute, and we're going to be talking today about how laser therapy clinics work, what you can expect if you are seeking laser therapy, what to look for when you walk in the door to a laser therapy clinic, and then how to evaluate if what you're getting is effective. So first thing is, I'm going to tell you, if you go to a LTI or Laser Therapy Institute member clinic, you're going to get great laser therapy. However, we don't have clinics everywhere yet. So you may be seeking laser elsewhere, and I think it's important to know that even though laser has been well proven to be effective in many conditions, there are cases out there that don't do well with laser therapy, and there are some clinics that don't quite have the knowledge and the equipment that they need in order to deliver really effective care. So how do you spot that as a patient? What do you look for? How do you know? So first of all, what I want you to do is go to lasertherapyinstitute.org, go to the Find a Provider link, and look and see if you've got one of our clinics near you. Because if you do, we've already done the homework for you. We know they have good equipment. We know they have excellent techniques. They have great protocols that we know work very well. So you're not going to have to worry about it at all. If you go to a Laser Therapy Institute clinic, that's already been nailed down. These guys are the absolute best of the best. There are differences between individual Laser Therapy Institute clinics, though, and that a lot of times comes down to the practitioner running it. We have chiropractors that really focus on neuropathy care, and then others that are focusing on musculoskeletal injuries, back and neck pain. We have some people that are focusing more on the superficial tissues like wound healing and scar reduction. So there are some differences there. A good thing to do is to look on the website, see if you've got somebody near you, and then call them. Tell them what you've got going on and see if they're the right choice for you to go see. If they bring you into the clinic and they recommend care, absolutely they are the ones you want to be seeing. If that's not quite within their wheelhouse, they'll be the ones to tell you that you should be looking elsewhere. For the vast majority of people, though, you're not going to have an LTI clinic right around the corner yet. Not yet. So when you have laser therapy recommended to you, what do you need to look for? Well, number one, the practitioner should be comfortable using the equipment. If they look like they're guessing, you might want to give them some time to gather a little bit more training and get a little bit more confidence in what they're doing. If they don't quite know what they're doing with the machinery, that's a good indication that they don't quite know how to treat your condition. And that goes to, they should know about your condition also. If you're going into an excellent physical therapist who's amazing with helping rotator cuff injuries, but you want them to do some work on your wound with their laser, that may not be within their field of expertise that they may not feel quite comfortable working on. So you want to make sure that not only does the practitioner feel comfortable and confident with their equipment, but also comfortable and confident with your condition. Now here's the next piece. The equipment does matter. The equipment makes a big difference. We have seen excellent results with Class 4 devices that use multiple wavelengths. Those are generally going to be your best bet. The brand names on those are K-Laser or Sumus Laser. Those have the 4 separate wavelengths. Those are in the Class 4 range. They work really well for tissue repair. However, there are excellent lasers by Lightforce that use 2 wavelengths, and they can do very well with especially musculoskeletal conditions like back, neck pain, shoulder, knees, hips, and so forth. You'll find those more frequently in a physical therapist's office, but they're everywhere too, and those are very good units also. If you're getting at a Class 3 device, which is a lower power machine, there are good ones out there also. However, the treatments are probably going to take a little bit longer, and they are probably not going to be as effective in some of the really deep tissue injuries. And that would be things like the lower back and the hip joints, sometimes the knees also. And that is not to say they cannot be effective. It's just not as likely to be as effective as a Class 4 device. And I don't mean to downplay the effectiveness of any Class 3 devices. I started on Class 3 devices. But you're going to have overall better effect, given now all other variables being equal, you're going to have better effects with a Class 4 device. If you've got a Class 3 that you're looking at, BioFlex units, Thor units, they really can be very effective. There has been some talk out there that Class 4 lasers always damage tissues and always burn the skin, and that is not true. If you've been listening to our podcasts, you know that there's excellent scientific evidence that Class 4 lasers deliver very good results when it comes to tissue healing, and so can Class 3 units. But a Class 4 laser can be anything from an older 2 or 3 watt unit all the way up to the military lasers that shoot down drones. There's a huge range there. So when you hear Class 4, it doesn't mean burning, cutting, or surgery necessarily. It can. It just means anything that's more than half a watt of power. So we use 20 watt K lasers every day in our office, and these have been excellent. We deliver 10,000 treatments a year or so, and we've never had anyone that's been injured by what we do. We have very, very good results, very rapid results in a large number of conditions. So let's talk about conditions for a minute. What conditions really respond well with laser therapy of any type? There's a few. There's a few that can pretty reliably do well, and those are tendinitis injuries, tendinitis, inflammatory conditions that go on around the tendons in the shoulders, the knees, the hips, bursitis as well. Bursitis in the hip especially, we've seen just, within a couple hours, just fantastic results in reducing that pain and getting people back to where they can sleep on their side again. So in anything inflammatory, like a tendinitis or a bursitis. We've also seen excellent results with headaches and traumatic brain injuries. We also see excellent results with neuropathies, any level of nerve damage. So those are your kind of broad categories that anyone you go to for laser therapy should be able to get you some level of results. Tendinitis, bursitis, inflammatory stuff like that. Any level of head injuries in the mild category, especially if they're associated with a headache, and then also nerve damage or neuropathy. Those should be fairly easy to address with laser therapy as long as you get someone who's going to be effective with what they're doing. They know what they're doing, they've had the proper training, and they've got good equipment. Here's the next piece, and everyone wants to know this one, usually well before they even find out if laser can help them. How much is it going to cost? Well, there are some times when your checkbook cannot fix what you have. So in some cases, like neuropathy or traumatic brain injury, it doesn't matter what it costs. Now, but it does matter what it costs, right? You can't pay thousands of dollars for 1 or 2 treatments if that's not going to work. It should be reasonable, but look, if you're going to get effective treatment, you need to expect to pay what that treatment is worth. I'll tell you, in our clinic, just in the last 4 years, we've gotten about 70% faster with our results, meaning that a patient that would come in for 30 visits 4 years ago, now they're in for 10 and they're getting the same results. And we managed to keep our pricing very, very similar to what it has been for years, but people are getting more out of it. Still, this is going to cost you something out of pocket. In most cases, insurance is not going to cover this in many states. In our clinic in Montana, it actually does cover for most people quite well. But in many states, you're going to have to pay for some of this out of pocket. So get an estimate from the provider you go see. Ask them for about how many treatments they think you might need or what their plan is. Many times patients respond differently, so there's not just across the board exact number that many times we can give a patient, but we can ballpark it. We can give you an idea and we can tell you about what it's going to cost. Just understand that this is not going to be this is not going to be a 5-minute e-stim treatment, or a TENS therapy that you're going to pay $5 for and not really get anything out of. If this is effective, if this is going to be able to help you with conditions that really have no other way to treat, there's going to be something you have to contribute there in order to get this done. But this is where I'll also caution you to not sign up for an unending treatment plan. It is many times necessary to have 10, 20, 30 treatments. Yes, absolutely. However, it should not be an ongoing thing. You're going to see me 3 times a week for 6 months, and then twice a week for 3 months, and then once a week for 4 more months, and then you're going to see me every 2 weeks for the rest of your life. That's not what this is designed to do. Laser therapy is designed to help the tissues heal and become more efficient and work the way they're supposed to, meaning that you should have lasting results from what you do. We should be able to accomplish a goal, and then the body should be able to maintain that goal. The exception to that is severe arthritis. Severe arthritis is one where you're going to have to do some upkeep on it. That comes down to your activity levels and whether or not you're exercising, how often things get flared up. But those cases, you might have to go get some maintenance work done occasionally. But if someone's trying to recommend, these 2 or 3 year long treatment plans, even if they do include laser, it really is something that I would encourage you to be hesitant to sign up for. Because in most cases, we just don't see that being necessary. If a provider really doesn't know what they're doing and you want to encourage them to get with us, or they indicate that they're interested in laser, maybe you've asked about it and they've said, well, I've always heard about laser, but I don't really know what to do, send them to us. We'll show them what to do. We'll make sure they get the right equipment and the right training, and they can be experts in delivering laser therapy treatments. And this has been a little bit of a wandering, meandering conversation here, but these are a lot of the questions that I hear from folks that call in and they're looking for someone to help them in their area. They end up with a whole lot of questions about, well, number one, can laser help my whatever condition's going on? And what do I need to look for when I go see somebody? How do I know that I'm getting the right thing? And then what's it going to cost? I mean, these are questions that we have to answer all the time. Again, go to an LTI clinic if you've got one near you, because that's what we do. We do the best, absolute best treatments that are out there. We have excellent equipment, top of the line equipment at all of our clinics. And you're going to see a doctor that actually cares about your progress and their success rates, that actually will give you a treatment plan. That is something we train all of our clinics at Laser Therapy Institute. We train them up with what treatment plans look like, so they can give you an idea on how many treatments might be required for your condition. They'll sit you down, they'll go through things, make a recommendation for care, and then you can decide if you want to do it. So look for an LTI clinic first thing. And then if you're having trouble finding somebody, get in touch with us. We can help find someone in your area who might be effective enough for you to be able to go and see and get good results. The research says laser therapy can be effective, but there's definitely an art to applying it. There's definitely equipment out there that is subpar. There are practitioners out there who may not be comfortable or familiar enough with these machines to be able to deliver the treatments. So look for these signs as you go in searching, and if you need help, get a hold of us. Send us your additional questions. If you have questions about yourself, or you want to know more about laser and the way laser works, the way that laser is used within a PT or a chiropractic or a medical office, or the way that someone's been using laser to treat you, or you want to even just share your story, send us an email. We'd love to hear it. We'd love to feature it on the podcast, and we'd like to be able to answer your questions here in the future. So until next week, thanks very much for joining us, and we'll talk to you soon.
Subscribe to this weekly podcast for more great information. Find a certified laser therapy clinic near you at lasertherapyinstitute.org. If you're a healthcare provider, check out our practitioner-focused Laser Therapy Institute podcast. Thanks for listening.